Hi, Dr. Emily Kirby here, board certified plastic surgeon at Kirby Plastic Surgery and Kalos Medical Spa. And we had a lot of great questions after yesterday's videos, so I'm going to try to answer a few more questions that people had today. Everybody's asking about wearing masks in public, and you may look around and see a lot of people wearing masks. This is a typical surgical mask, which is actually a little bit thicker and more reinforced than just wearing fabric, which sometimes you see on people on the news. And when it fits appropriately, there's a little wire by the nose and it fits around the chin and then ties in the back. What you'll see when we wear this appropriately is that there's a gap here. This is not totally tight. And under the chin, there's a lot of air moving right here. What that means for coronavirus, since coronavirus is spread mostly by aerosolized droplets, this means that little gaps like that in the mask aren't going to do anything to help you. So when people are saying wear a mask in public, it's not going to help you. What we're saying about covering your cough is turn away, cough into the corner of your elbow, cough into a napkin or something that will contain the aerosolized droplets. What we talked about with my kiddos, who are 8 and 10 years old, is picture when you're outside in the cold and you breathe and you see your breath in the air. All of that breath that you see extends for about a distance of 3 feet. And in every single one of those little droplets could be coronavirus, if you've got it. Sometimes you don't know that you have it. But the idea is containing those droplets. And the whole idea with social distancing is 3 feet from me, 3 feet from you means 6 feet distance between us. And that's considered the safe distance that when we walk by each other, we won't breathe on each other and take each other's aerosolized droplets of coronavirus in through our respiratory system. That's the idea in trying to contain the spread. If you look at different types of masks, such as the N95 mask, which I can't show you because I don't have one, but the N95 mask is historically used for something such as tuberculosis, which is also transmitted in a similar fashion. And what that mask does is it forms a very tight seal all the way around. It's quite uncomfortable to wear, but it seals the entire area. Healthcare workers get tested in what's called a fit mask test or a mask fit test. And what they do is they actually pump a very fragrant substance into the air while we're wearing the mask, and we breathe deeply several times, and they can either ask us if we smell the mask, which is smell the fragrance, which is a little more old-fashioned, or they can actually measure the number of parts per million in the droplets that are actually coming into the mask. That's a little bit more advanced that they've been doing in the past few years. So it's super important that our front-line healthcare workers have these N95 masks. Do you and I need to walk around with them? Absolutely not. What we need to do is actually socially distance, stay inside, close businesses, stay home, and avoid one another in order to help control the spread of coronavirus. The White House press conference today asked for construction companies and construction suppliers to donate their N95 masks to hospitals and other frontline healthcare workers that need these masks. And I think that is so imperative to protect our medical teams that are out there dealing with this every day. A story came out of Italy today that was very sad. It was a story about a doctor named Robert Steller who kept treating patients when the protection ran out. There were no masks, there were no gloves, there were no gowns, and some people are estimating that we are 10 to 14 days behind Italy. Now, we have a different healthcare system, thank goodness for that. We do not have socialized medicine, so we do have more available materials, more available personnel, staff, supplies, ventilators, but it is very important that we not overwhelm the system. So that's part of social distancing, staying home, stop the spread, listen to the White House 15 days to slow this down. And if you haven't seen it, we can refer you to a few websites that I will put in the notes after the video. Take care, stay safe, and socially distance.